Imagine you're walking through the woods and suddenly you spot a bear. Instantly, your heart races, your breathing quickens, and your body floods with energy. That is your survival alarm, the classic fight or flight response kicking in exactly as nature intended to keep you alive. But what happens when that evolutionary alarm gets stuck in the on position, even when there's no bear anywhere in sight? What happens when everyday life literally starts to feel like a constant invisible threat? Welcome to this explainer. Today, we're going to look right past the stigma and break down the actual neurobiology of anxiety disorders. We're diving straight into the medical science to validate these conditions for what they truly are: real, biological, and highly treatable medical conditions. It's absolutely not just in your head, it's in your biology. And the good news, we have the tools to understand and manage it. Here is our roadmap for today. First, we'll distinguish between normal stress and an anxiety disorder. Second, we'll unpack the biology of fear. Third, we'll cover the types, symptoms, and diagnosis. And finally, we'll explore evidence-based treatment and recovery. Let's jump right into Section 1, normal stress or anxiety disorder. So, there is actually a very clear boundary in clinical medicine between the two. Normal stress is proportionate, temporary, and manageable. You know, like interview jitters, it rises to meet a challenge and then it recedes. But an anxiety disorder, that's characterized by fear that is excessive and persistent. It doesn't just fade away when the stressful event is over, and most importantly, it severely disrupts daily life. It actively stops you from doing the things you want or need to do. If you're struggling with this, please know it is not a character flaw. It is a distinct, diagnosable medical condition. Moving on to Section 2, the biology of fear. To really understand anxiety, we have to look at the amygdala. Think of it as the brain's threat detection center, or a biological smoke detector. It regulates fear alongside critical neurotransmitters, these chemical messengers like GABA, serotonin, and norepinephrine. Now, in a healthy brain, these chemicals keep your fear and stress responses perfectly balanced, telling you exactly when to be alert and when to relax. But in an anxiety disorder, that smoke detector becomes hypersensitive, and the chemical signals get crossed. Your brain is basically telling your body there's a life-threatening emergency when, in reality, you're perfectly safe. And the physical cascade that follows is intense. Step 1, that hypersensitive amygdala falsely detects a threat. Step 2, your body just floods with stress hormones like adrenaline and cortisol. Step 3, your sympathetic nervous system is fully activated. We're talking heart rate spiking, rapid breathing, sweating, muscles clenching. Your body is intensely preparing to fight or flee. But because it's a false alarm, there's nowhere for all that massive physical energy to go. It's a highly protective evolutionary mechanism for sure, it's just firing completely out of context. Which brings us to Section 3, types, symptoms, and diagnosis. Now, that underlying biological misfire we just talked about, it presents differently depending on the specific diagnosis. With generalized anxiety disorder, or GAD, it usually manifests as persistent, excessive worry about everyday things, like health, money, or family. In panic disorder, it's a sudden, unprovoked terror that strikes entirely without warning. And in social anxiety disorder, the brain's threat detection is specifically hyper-focused on social interactions, bringing this profound fear of being judged. They all share the exact same underlying biological roots, but the trigger and the lived experience are entirely unique for the patient. When that alarm is blaring, the symptoms can hit every part of a person's life in a rapid barrage. Emotionally, you see intense fear and severe irritability. It's also heavily physical: heart palpitations, sweating, dizziness, shortness of breath. Cognitively, it causes poor concentration, catastrophic thinking, and racing thoughts that literally just won't stop. And ultimately, it becomes behavioral. The single most common behavioral symptom here is avoidance. People will start withdrawing socially or completely upending their daily routines just to avoid triggering another alarm. A really crucial clinical distinction we need to make is separating a panic attack from a heart attack. I mean, presenting to an emergency department with chest tightness, rapid heartbeat, shortness of breath, and a fear of dying is utterly terrifying. A panic attack causes intense fear, physical tingling, and a profound feeling of losing control. It feels exactly like a medical emergency. However, a heart attack has distinct cardiac indicators that doctors look for. We completely validate the sheer terror of a panic attack because those physical sensations are very real, but modern medicine has precise ways of separating the two. So how do clinicians actually diagnose these disorders? They use standard evidence-based tools. It always starts with a comprehensive psychiatric interview. Then they'll use standardized anxiety rating scales, things like the GAD-7 or the HAM-A, to objectively measure just how severe the symptoms are. And this is super important. They use laboratory tests like checking thyroid function, blood glucose, or running an ECG. Why? To confidently rule out any hidden physical illnesses. A doctor wants to be absolutely certain they are treating an anxiety disorder and not an underlying thyroid issue or heart arrhythmia that just happens to be causing anxiety-like symptoms. Finally, let's look at Section 4, Evidence-Based Treatment and Recovery. Our main clinical pillars here are psychotherapy and medication. Psychotherapies like cognitive behavioral therapy or CBT are incredibly effective. They literally help rewire that catastrophic thinking and teach patients how to tolerate and turn down the volume on the false alarm. On the medication side, things like SSRIs and SNRIs work to actively balance those specific neurotransmitters in the brain we discussed earlier, bringing the baseline back to normal. Now, fast-acting options like benzodiazepines do exist for rapid relief, but they require strict medical supervision because of the risks of dependence. Often, a tailored combination of both therapy and medication is the absolute gold standard. But treatment isn't just confined to a doctor's office. Lifestyle management plays a massive empowering role in recovery. Think about it. Regular physical activity naturally burns off that excess adrenaline. Strict sleep hygiene gives a highly stressed brain the critical downtime it needs to repair. Limiting caffeine is a huge one. Caffeine can directly mimic and trigger that very fight-or-flight response we're trying to calm. And practicing breathing exercises actively trains your parasympathetic nervous system to physically calm the body down. The patient is an active participant with immense control over their own recovery. When we put all these guidelines into practice, a really clear, real-world clinical path emerges. Step 1 is early recognition, actually realizing it's more than just normal stress and asking for help. Step 2 requires a comprehensive biopsychosocial assessment, making absolutely sure to rule out physical issues. Step 3 introduces a tailored treatment plan, maybe pairing CBT to manage racing thoughts with an SSRI to balance brain chemistry. And finally, Step 4 ensures long-term follow-up and rehabilitation. This isn't just theory, folks. This is the proven, step-by-step path that millions take to successfully get their lives back. I want to leave you with this core truth directly from the scientific consensus. Anxiety disorders are among the most common mental health conditions, but they are highly treatable. Early recognition can help people regain confidence and live fulfilling lives. If your internal alarm system is stuck on, you don't have to live in a state of emergency forever. The biology is clear, and the treatments are completely evidence-based. It really makes you wonder, though, if our brains evolved this incredibly powerful alarm system to keep us alive, what else might we be able to train it to do once we take back control?